81. A nurse is caring for a patient with HIV who is newly diagnosed with toxoplasmosis. What is the most important intervention for this patient? A. Administer prescribed antibiotics. B. Encourage a high-protein diet. C. Recommend bed rest and limited activity. D. Restrict fluid intake. Answer. A. Administer prescribed antibiotics. Rationale. Toxoplasmosis is an opportunistic infection that requires antibiotic treatment. Early intervention is essential to prevent further complications in immunocompromised patients with HIV. 82. A nurse is caring for a patient with HIV and reports nausea and vomiting after starting ART. What is the nurse's most appropriate action? A. Notify the healthcare provider about potential medication side effects. B. Administer antiemetic medication immediately. C. Suggest the patient stop taking the ART until symptoms resolve. D. Reassure the patient that this is a normal side effect. Answer. A. Notify the healthcare provider about potential medication side effects. Rationale. Nausea and vomiting may be side effects of ART. It is important to notify the healthcare provider to determine whether a medication change is needed. 83. A nurse is providing education to a patient with HIV about the importance of monitoring CD4 count. Which of the following should the nurse emphasize? A. CD4 count helps determine the stage of HIV infection. B. A high CD4 count increases the risk of opportunistic infections. C. A low CD4 count indicates the need for ART to be adjusted. D. The CD4 count does not affect treatment decisions. Answer. A. CD4 count helps determine the stage of HIV infection. Rationale. CD4 count is an important marker used to determine the immune function of a patient with HIV and helps guide treatment decisions. A low CD4 count indicates a higher risk for opportunistic infections. 84. A nurse is assessing a patient with HIV who is complaining of muscle weakness and tingling in the hands and feet. Which of the following is most likely the cause of these symptoms? A. It's peripheral neuropathy due to HIV. B. Electrolyte imbalance caused by ART. C. Nutritional deficiency due to poor diet. D. Involvement of the central nervous system due to HIV. Answer. A. Peripheral neuropathy due to HIV. Rationale. Peripheral neuropathy is a common complication in patients with HIV, especially those on ART, and can cause tingling and muscle weakness in the extremities. 85. A nurse is teaching a patient with HIV about the importance of regular dental checkups. Why is dental care particularly important for this patient? A. HIV can cause mouth sores, gingivitis, and oral infections. B. Oral hygiene has no impact on the patient's overall health. C. Dental care prevents gastrointestinal issues related to ART. D. Patients with HIV should avoid all dental care. Answer. A. HIV can cause mouth sores, gingivitis, and oral infections. Rationale. People with HIV are at higher risk for oral health issues, including mouth sores and infections, which can complicate their overall health. Regular dental care is vital for managing these risks. 86. A nurse is educating a patient with HIV who has recently started antiretroviral therapy, ART, about possible long-term side effects. Which of the following should the nurse include in the teaching? A. You may experience changes in body fat distribution, such as increased fat in the abdomen. B. You will likely experience consistent weight loss. C. ART is unlikely to cause any long-term side effects. D. Your bone health will remain unaffected by ART. Answer. A. You may experience changes in body fat distribution, such as increased fat in the abdomen. Rationale. One of the known side effects of ART is changes in body fat distribution, including fat accumulation in the abdomen, a condition known as lipodystrophy. 87. A patient with HIV is experiencing night sweats and unexplained fever. What is the most likely explanation for these symptoms? A. Opportunistic infection, such as tuberculosis or cytomegalovirus, CMV. B. Medication-related side effects from ART. C. Early stage of HIV seroconversion. D. Allergic reaction to HIV medications. Answer. A. Opportunistic infection, such as tuberculosis or cytomegalovirus, CMV. Rationale. Night sweats and fever can be signs of an opportunistic infection, which are common in individuals with HIV, particularly during periods of immune suppression. 88. A nurse is teaching a patient with HIV about preventing the transmission of the virus to others. Which statement by the patient indicates a need for further teaching? A. I will always use a condom during sexual activity. B. I can stop using condoms when my viral load is undetectable. C. I should avoid sharing needles or other injection equipment. D. I should inform my sexual partners about my HIV status. Answer. B. I can stop using condoms when my viral load is undetectable. Rationale. While undetectable viral load greatly reduces the risk of transmission, condom use is still recommended for additional protection and to reduce the risk of other sexually transmitted infections. 89. A nurse is caring for a patient with HIV who is experiencing anxiety about the disease. What is the most appropriate response by the nurse? A. It's important to focus on the present and not worry about the future. B. I understand that you are anxious. Let's discuss your concerns. C. There is no reason to be anxious. HIV can be easily managed. D. I will refer you to a psychiatrist for immediate therapy. Answer. B. I understand that you are anxious. Let's discuss your concerns. Rationale. Acknowledging the patient's anxiety and providing a supportive environment to discuss concerns fosters trust and helps reduce emotional distress related to the HIV diagnosis. 90. A patient with HIV is scheduled for a routine visit. Which of the following tests is most important to assess the effectiveness of antiretroviral therapy? ART? A. Viral load test. B. CD4 count. C's complete blood count, CBC. D. Liver function tests. Answer. A. Viral load test. Rationale. The viral load test measures the amount of HIV in the blood and helps determine the effectiveness of ART. A suppressed viral load indicates effective therapy. 91. A nurse is caring for a patient with HIV who is scheduled for a colonoscopy. What is the most important consideration for the nurse? A. Assess for any signs of opportunistic infections. B. Ensure that the patient has received all routine vaccinations. C. Monitor for any changes in the patient's HIV medications. D. Review the patient's nutritional status. Answer. A. Assess for any signs of opportunistic infections. Rationale. Patients with HIV are at higher risk for opportunistic infections, including gastrointestinal infections. It is important to assess for any such infections before invasive procedures like a colonoscopy. 92. A nurse is caring for a patient with HIV who is newly diagnosed with cryptosporidiosis. Which of the following is the most likely cause of this infection? A. Immunosuppression due to HIV. B. Recent travel to a foreign country. C. Poor hand hygiene after handling food. D. Inadequate water filtration. Answer. A. Immunosuppression due to HIV. Rationale. Cryptosporidiosis is an opportunistic infection that affects immunocompromised individuals, especially those with HIV. 93. A patient with HIV presents with a new skin rash and oral ulcers. What is the nurse's most appropriate action? A. Notify the healthcare provider for further evaluation. B. Administer prescribed pain medication. C. Encourage the patient to increase fluid intake. D. Reassure the patient that this is a normal symptom of HIV. Answer. A. Notify the healthcare provider for further evaluation. Rationale. A new skin rash and oral ulcers in an HIV patient could be signs of an opportunistic infection or a medication side effect. Immediate evaluation by the healthcare provider is necessary to determine the cause and appropriate treatment. 94. A nurse is caring for a patient with HIV who is exhibiting signs of wasting syndrome. What is the nurse's priority intervention? A. Monitor the patient's nutritional intake and weight. B. Encourage increased physical activity. C. Administer appetite stimulants. D. Provide emotional support to the patient. Answer. A. Monitor the patient's nutritional intake and weight. Rationale. Wasting syndrome is characterized by significant weight loss and malnutrition. Close monitoring of nutritional intake and weight is essential for managing this condition. 95. A nurse is teaching a patient with HIV about the importance of preventing opportunistic infections. Which of the following activities should the nurse recommend to reduce the risk? A. Hand hygiene and avoiding large crowds. B. Limiting intake of high-protein foods. C. Taking all medications at night. D. Avoiding physical exercise. Answer: A. Hand hygiene and avoiding large crowds. Rationale: hand hygiene and avoiding large crowds are key strategies for preventing the spread of infections, especially for immunocompromised individuals with HIV. 96. A nurse is assessing a patient with HIV who is newly diagnosed with pneumocystis pneumonia, PCP. Which of the following findings is most indicative of this condition? A. Shortness of breath and a non-productive cough. B. Chest pain and wheezing. C. Persistent fever and night sweats. D. Hemoptysis and fatigue. Answer: A. Shortness of breath and a non-productive cough. Rationale: pneumocystis pneumonia, PCP, commonly presents with shortness of breath, a non-productive cough, and fever. This is an opportunistic infection in HIV patients, requiring early intervention. 97. A nurse is caring for a patient with HIV who is receiving ART. The patient reports feeling fatigued and nauseous. What is the first step the nurse should take? A. Assess the patient's medication adherence and side effects. B. Offer fluids to prevent dehydration. C. Encourage the patient to rest. D. Administer anti-nausea medications. Answer: A. Assess the patient's medication adherence and side effects. Rationale: fatigue and nausea may be side effects of ART. It is essential to assess for medication side effects and ensure the patient is adhering to the prescribed regimen before implementing other interventions. 98. A nurse is preparing to administer ART to a patient with HIV. Which of the following is the most important action to ensure the medication's effectiveness? A. Monitor the patient's adherence to the prescribed regimen. B. Administer ART with food for better absorption. C. Provide the patient with information about ART side effects. D. Encourage the patient to take ART at any time of day. Answer: A. Monitor the patient's adherence to the prescribed regimen. Rationale: adherence to ART is critical for achieving viral suppression. Monitoring the patient's adherence to the regimen ensures the effectiveness of the treatment plan. 99. A nurse is caring for a patient with HIV and reports having difficulty remembering to take their ART medication. What is the most appropriate nursing intervention? A. Set up a pillbox with daily doses. B. Decrease the number of medications prescribed. C. Suggest taking ART at random times each day. D. Instruct the patient to stop the ART until they feel ready. Answer: A. Set up a pillbox with daily doses. Rationale: a pillbox helps patients organize their medications and reminds them to take their doses consistently, improving adherence to ART. 100. A nurse is educating a patient with HIV about preventing the transmission of HIV to a partner. Which of the following should the nurse emphasize? A. Consistent use of condoms during sexual activity. B. Avoiding sexual activity altogether. C. Taking ART without the use of condoms. D. Only using condoms during symptomatic outbreaks. Answer: A. Consistent use of condoms during sexual activity. Rationale: using condoms consistently and correctly is one of the most effective ways to prevent the transmission of HIV to sexual partners, regardless of the patient's viral load. 101. A nurse is caring for a patient with HIV who is on ART. The patient is concerned about drug resistance. What is the nurse's most appropriate response? A. Drug resistance is uncommon if you take your medications as prescribed. B. You can skip doses occasionally if you are feeling well. C. It is not necessary to follow a strict regimen. D. You can stop ART if you feel better. Answer: A. Drug resistance is uncommon if you take your medications as prescribed. Rationale: consistently taking ART as prescribed helps prevent drug resistance. Skipping doses or stopping the medications can lead to resistance. 102. A nurse is caring for a patient with HIV who is experiencing confusion and memory loss. What is the most likely cause of these symptoms? A. HIV-associated neurocognitive disorder, HAND. B. Electrolyte imbalance. C. Side effects of ART. D. Acute HIV infection. Answer: A. HIV-associated neurocognitive disorder, HAND. Rationale: HIV-associated neurocognitive disorder, HAND, can cause memory loss and confusion in patients with HIV. It is a result of HIV affecting the central nervous system. 103. A nurse is caring for a patient with HIV who is concerned about the risk of transmitting the virus to their baby. What is the nurse's most appropriate response? A. You can reduce the risk of transmission by starting ART during pregnancy. B. There is no risk of transmission to the baby with proper care. C. Breastfeeding is safe if you have HIV. D. Avoid all medications during pregnancy. Answer: A. You can reduce the risk of transmission by starting ART during pregnancy. Rationale: starting ART during pregnancy significantly reduces the risk of vertical transmission of HIV from mother to baby. It is also recommended to avoid breastfeeding to reduce transmission. 104. A nurse is educating a patient with HIV about the importance of managing opportunistic infections. Which statement by the patient indicates a need for further teaching? A. I need to take all medications as prescribed to prevent infections. B. I should avoid crowded places to reduce exposure to germs. C. Vaccinations will help prevent opportunistic infections. D. Once I feel better, I can stop taking my medications. Answer: D. Once I feel better, I can stop taking my medications. Rationale: adherence to ART is essential for preventing opportunistic infections. Stopping medication can lead to worsening of symptoms and infections. 105. A nurse is caring for a patient with HIV who is starting to experience diarrhea. What is the most important action the nurse should take? A. Assess for signs of dehydration. B. Encourage the patient to avoid all foods and fluids. C. Give antidiarrheal medication immediately. D. Advise the patient to rest and take fluids. Answer: A. Assess for signs of dehydration. Rationale: diarrhea can lead to dehydration, which is dangerous for patients with HIV. Assessing hydration status is crucial to prevent further complications. 106. A nurse is educating a patient about the proper use of ART. Which of the following should the nurse emphasize to prevent drug resistance? A. Take your medication exactly as prescribed, even if you feel better. B. It is okay to miss doses if you don't feel sick. C. Skip doses when you are not experiencing symptoms. D. It is okay to share medications with others in need. Answer: A. Take your medication exactly as prescribed, even if you feel better. Rationale: consistency in taking ART is vital to prevent resistance. Missing doses or stopping treatment can lead to the virus mutating and becoming resistant to the medications. 107. A nurse is caring for a patient who is newly diagnosed with HIV. The patient is anxious about the diagnosis. What is the most appropriate nursing action? A. Provide a quiet environment for the patient to rest. B. Refer the patient to a counselor or support group. C. Tell the patient that everything will be okay. D. Ignore the patient's concerns to prevent further anxiety. Answer: B. Refer the patient to a counselor or a support group. Rationale: emotional and psychological support is important for patients with HIV. Referral to a counselor or support group provides resources to help the patient cope with the diagnosis. 108. A nurse is assessing a patient with HIV who is at risk for developing Kaposi sarcoma. What is the nurse's priority action? A. Monitor for the appearance of purple or red lesions on the skin. B. Educate the patient about ART adherence. C. Measure the patient's oxygen saturation levels. D. Monitor the patient for signs of respiratory distress. Answer: A. Monitor for the appearance of purple or red lesions on the skin. Rationale: Kaposi sarcoma is a common cancer in HIV patients and presents as purple or red lesions on the skin. Early detection is crucial for effective treatment. 109. A nurse is caring for a patient with HIV who is experiencing increased anxiety about their diagnosis. Which of the following interventions is most effective? A. Provide information about HIV transmission and treatment options. B. Administer an anxiolytic medication immediately. C. Reassure the patient that everything will be fine. D. Ignore the patient's concerns to avoid reinforcing anxiety. Answer: A. Provide information about HIV transmission and treatment options. Rationale. Providing accurate and reassuring information about HIV transmission and treatment can reduce anxiety and help the patient feel more in control of their health. 110. A nurse is caring for a patient with HIV who is on ART. The patient is concerned about the long-term side effects of the medications. What is the nurse's best response? A. It's important to continue ART because the benefits outweigh the risks. B. Side effects are temporary and usually go away. C. There are no long-term side effects associated with ART. D. It's okay to stop ART if you experience side effects. Answer. A. It's important to continue ART because the benefits outweigh the risks. Rationale. While ART may have side effects, its benefits in managing HIV and preventing complications outweigh the risks. Stopping ART can lead to disease progression. 111. A nurse is caring for a patient with HIV who has a low CD4 count. The nurse understands that this patient is at increased risk for which of the following? A. Opportunistic infections. B. Hypertension. C. Hyperglycemia. D. Acute myocardial infarction. Answer. 8. Opportunistic infections. Rationale. A low CD4 count indicates that the immune system is compromised, which increases the risk for opportunistic infections. 112. A nurse is caring for a patient with HIV who is receiving ART. The patient asks about the importance of adherence to the regimen. What is the nurse's best response? A. Adherence to ART is essential to maintain viral suppression and prevent drug resistance. B. Skipping doses occasionally won't affect your treatment. C. You can stop ART once your viral load is undetectable. D. You don't need to worry about adherence as long as you feel well. Answer. A. Adherence to ART is essential to maintain viral suppression and prevent drug resistance. Rationale. Adherence to ART is critical to maintaining viral suppression and preventing resistance. Skipping doses can lead to treatment failure and resistance. 113. A nurse is assessing a patient with HIV who is experiencing unintentional weight loss. What should the nurse investigate first? A. Assess the patient's nutritional intake and appetite. B. Check the patient's renal function. C. Assess for signs of dehydration. D. Review the patient's medication regimen. Answer. A. Assess the patient's nutritional intake and appetite. Rationale. Unintentional weight loss in HIV patients can be due to poor nutrition or decreased appetite, and addressing these issues is essential for managing wasting syndrome. 114. A nurse is educating a patient with HIV about safe sexual practices. Which of the following statements by the patient indicates a need for further teaching? A. I should use condoms consistently with all sexual partners. B. I can safely engage in unprotected sex if my viral load is undetectable. C. I will notify my sexual partner about my HIV status. D. I will avoid sharing needles or injection equipment. Answer. B. I can safely engage in unprotected sex if my viral load is undetectable. Rationale. Even with an undetectable viral load, condom use is recommended to reduce the risk of HIV transmission and prevent other sexually transmitted infections. 115. A nurse is caring for a patient with HIV and reports difficulty adhering to their medication regimen. What is the nurse's priority intervention? A. Discuss the importance of ART adherence and set up a pill reminder. B. Suggest taking the medication at any time of day. C. Reassure the patient that missing a dose occasionally is not harmful. D. Recommend stopping the medication temporarily. Answer. A. Discuss the importance of ART adherence and set up a pill reminder. Rationale. Adherence to ART is critical for managing HIV. Using a pill reminder system can help improve adherence and prevent treatment failure. 116. A nurse is caring for a patient with HIV who is receiving treatment for tuberculosis. Which of the following is most important for the nurse to assess? A. The patient's liver function. B. The patient's HIV medication adherence. C. The patient's fluid intake. D. The patient's nutritional intake. Answer. A. The patient's liver function. Rationale. Tuberculosis treatment can affect liver function, especially in patients receiving ART. It is essential to monitor liver function in this population. 117. A nurse is caring for a patient with HIV who is newly diagnosed with oral candidiasis. What is the priority nursing intervention? A. Administer antifungal medication as prescribed. B. Provide the patient with oral hygiene instructions. C. Monitor for signs of systemic infection. D. Educate the patient about ART adherence. Answer. A. Administer antifungal medication as prescribed. Rationale. Oral candidiasis is a fungal infection that is common in HIV patients. Administering the appropriate antifungal treatment is the priority intervention. 118. A nurse is caring for a patient with HIV who is about to undergo a colonoscopy. What is the nurse's priority action before the procedure? A. Ensure that the patient has a negative HIV viral load. B. Assess the patient for signs of opportunistic infections. C. Monitor the patient for gastrointestinal bleeding. D. Check the patient's medication list for potential interactions. Answer. B. Assess the patient for signs of opportunistic infections. Rationale. Patients with HIV are at increased risk for opportunistic infections, which should be evaluated prior to invasive procedures, such as a colonoscopy. 119. A nurse is educating a patient with HIV about ART. Which of the following statements indicates the need for further teaching? A. I will take my medications every day to keep the virus under control. B. It's okay to miss a dose occasionally, if I feel fine. C. ART can help prevent the progression to AIDS. D. I will continue ART even if I feel better. Answer. B. It's okay to miss a dose occasionally if I feel fine. Rationale. Missing doses can lead to drug resistance and treatment failure. ART should be taken consistently to manage HIV effectively. 120. A nurse is caring for a patient with HIV who is experiencing fatigue and weakness. What should the nurse prioritize in the assessment? A. Assess for anemia or other causes of fatigue. B. Encourage the patient to rest and avoid physical activity. C. Recommend increasing protein intake. D. Measure the patient's blood pressure. Answer. A. Assess for anemia or other causes of fatigue. Rationale. Fatigue and weakness may be caused by anemia, which is common in HIV patients. Identifying the underlying cause is essential for effective management. 121. A nurse is educating a patient newly diagnosed with HIV about the importance of routine lab tests. What is the nurse's best response? A. Routine lab tests will help monitor your CD4 count and viral load. B. Lab tests are not necessary unless you feel sick. C. You will need to undergo lab tests only once a year. D. The lab tests are only used to monitor ART side effects. Answer. A. Routine lab tests will help monitor your CD4 count and viral load. Rationale. Routine lab tests, including CD4 count and viral load, are critical for monitoring the progression of HIV and evaluating the effectiveness of ART. 122. A nurse is educating a patient with HIV about ART adherence. Which of the following is the most important aspect to emphasize? A. Take the medications exactly as prescribed to prevent drug resistance. B. It is okay to skip doses when you feel well. C. You can reduce the number of doses after a few months. D. Once you feel better, you can stop the medications. Answer. A. Take the medications exactly as prescribed to prevent drug resistance. Rationale. Consistency in taking ART as prescribed helps to maintain viral suppression and prevent the development of drug resistance. 123. A nurse is assessing a patient with HIV for signs of peripheral neuropathy. Which symptom is most commonly associated with this condition? A. Numbness and tingling in the feet and hands. B. Severe chest pain. C. Unexplained fever. D. Swelling in the ankles. Answer. A. Numbness and tingling in the feet and hands. Rationale. Peripheral neuropathy, a common complication of HIV or ART, is characterized by numbness and tingling in the extremities, especially the feet and hands. 124. A nurse is caring for a patient with HIV who is at risk for tuberculosis, TB. What is the nurse's priority intervention? A. Perform a tuberculosis skin test. B. Educate the patient about ART adherence. C. Monitor the patient for fever and night sweats. D. Administer a flu vaccine. Answer. Aids perform a tuberculosis skin test. Rationale: TB is a significant opportunistic infection for people with HIV. Early detection with a skin test can help prevent further complications. 125. A nurse is caring for a patient with HIV who is on ART and reports feeling nauseous and fatigued. What is the most likely cause of these symptoms? A. Side effects of ART medications. B. Acute HIV infection. C. Nutritional deficiency. D. Electrolyte imbalance. Answer: A. Side effects of ART medications. Rationale: nausea and fatigue are common side effects of ART, particularly in the initial phases of treatment. 126. A nurse is preparing a patient with HIV for discharge and needs to provide discharge teaching. Which of the following should the nurse emphasize? A. Adhere strictly to your ART regimen and follow-up appointments. B. Once you feel better, you can stop ART and follow up. C. You can miss doses occasionally if you feel well. D. You should avoid ART during stressful periods. Answer: A. Adhere strictly to your ART regimen and follow-up appointments. Rationale: adherence to ART and regular follow-up are key to managing HIV and preventing complications. 127. A nurse is caring for a patient with HIV who is at risk for pneumonia. Which of the following is the most important for the nurse to monitor? A. Respiratory status and oxygen saturation levels. B. Blood glucose levels. C. Electrolyte balance. D. Blood pressure. Answer: A. Respiratory status and oxygen saturation levels. Rationale: pneumonia is a common opportunistic infection in HIV patients. Monitoring respiratory status is critical for detecting respiratory distress early. 128. A nurse is caring for a patient with HIV who is experiencing fever and chills. What should the nurse do first? A. Assess the patient for signs of opportunistic infections. B. Administer antipyretics as ordered. C. Increase the patient's fluid intake. D. Recommend bed rest for the patient. Answer: A. Assess the patient for signs of opportunistic infections. Rationale: fever and chills may indicate an opportunistic infection, which is common in patients with HIV. Early identification of infections is crucial for appropriate treatment. 129. A nurse is caring for a patient with HIV and low CD4 count. The nurse understands that the patient is at increased risk for which of the following? A. Opportunistic infections. B. Hypertension. C. Hyperlipidemia. D. Diabetes mellitus. Answer: A. Assess for any contraindications to the prescribed medications. Rationale: before starting ART, it is crucial to assess for any contraindications, such as drug interactions or comorbidities that could affect the treatment plan. 130. A nurse is caring for a patient with HIV who is about to start ART. What is the nurse's primary responsibility before initiating ART? A. Assess for any contraindications to the prescribed medications. B. Teach the patient about the side effects of ART. C. Provide emotional support to the patient. D. Monitor vital signs closely. Answer: A. Assess for any contraindications to the prescribed medications. Rationale: before starting ART, it is crucial to assess for any contraindications, such as drug interactions or comorbidities that could affect the treatment plan. 131. A nurse is caring for a patient with HIV who is experiencing oral thrush. What is the priority nursing intervention? A. Administer antifungal medication as prescribed. B. Provide oral hygiene instructions. C. Assess the patient's hydration status. D. Encourage the patient to eat soft foods. Answer: A. Administer antifungal medication as prescribed. Rationale: oral thrush, a common opportunistic infection in HIV patients, requires antifungal treatment for resolution. 132. A nurse is educating a patient with HIV about prevention of opportunistic infections. What is the most important advice for the patient to follow? A. Follow your ART regimen and avoid exposure to sick individuals. B. Discontinue ART if you start feeling better. C. You don't need to worry about infections as long as you're feeling well. D. Avoid all contact with other people. Answer: A. Follow your ART regimen and avoid exposure to sick individuals. Rationale: Following ART helps prevent opportunistic infections, and avoiding exposure to illness is crucial due to the weakened immune system in HIV. 133. A nurse is caring for a patient with HIV who is newly prescribed efavirenz. Which of the following is the most important teaching point? A. Take the medication on an empty stomach to reduce nausea. B. This medication should be taken with food to reduce side effects. C. Efavirenz can cause vivid dreams and should be taken in the evening. D. Efavirenz can cause liver toxicity, so avoid alcohol. Answer. C. Efavirenz can cause vivid dreams and should be taken in the evening. Rationale. Efavirenz is known for causing vivid dreams and neuropsychiatric side effects. It is often recommended to take it at bedtime to minimize these effects. 134. A nurse is assessing a patient with HIV who is taking zidovudine. The nurse should monitor for which of the following potential side effects? A. Anemia and neutropenia. B. Hyperglycemia. C. Hypertension. D. Weight gain. Answer. A. Anemia and neutropenia. Rationale. Zidovudine can cause hematologic side effects such as anemia and neutropenia, so regular blood tests are important for monitoring. 135. A nurse is caring for a patient with HIV who has recently developed a rash. What is the nurse's first priority? A. Assess the rash and determine if it's related to medication. B. Apply soothing ointments to the rash. C. Recommend that the patient avoid scratching. D. Teach the patient about potential side effects of ART. Answer. A. Assess the rash and determine if it's related to medication. Rationale. A rash may be a side effect of ART or a sign of an allergic reaction. Assessing the cause is crucial to determine the appropriate response. 136. A nurse is caring for a patient with HIV who is experiencing dyspnea and has a history of pneumocystis jirovecii pneumonia, PCP. What is the nurse's priority action? A. Administer oxygen as needed and monitor respiratory status. B. Administer a bronchodilator. C. Encourage deep breathing exercises. D. Provide a high-calorie diet. Answer. A. Administer oxygen as needed and monitor respiratory status. Rationale. Dyspnea and a history of PCP suggest possible respiratory compromise. Administering oxygen and monitoring respiratory status are critical interventions for maintaining oxygenation. 137. A nurse is caring for a patient with HIV who is receiving rifampin as part of treatment for tuberculosis. What is the nurse's primary concern? A. Drug interactions with ART. B. Risk for gastrointestinal bleeding. C. Hepatic toxicity from ART and rifampin. D. Risk of hyperkalemia. Answer. A. Drug interactions with ART. Rationale. Rifampin can interact with ART medications, affecting their efficacy. Monitoring for potential drug interactions is important to ensure treatment effectiveness. 138. A nurse is caring for a patient with HIV and reports persistent diarrhea. The nurse should first assess for which of the following? A. Dehydration and electrolyte imbalances. B. Anemia from blood loss. C. Signs of a myocardial infarction. D. Hepatitis C infection. Answer. A. Dehydration and electrolyte imbalances. Rationale. Persistent diarrhea can lead to dehydration and electrolyte imbalances, which can be life-threatening. The nurse should assess for these complications. 139. A nurse is assessing a patient with HIV who reports fatigue and weight loss. Which of the following is the nurse's priority assessment? A. Nutritional intake and albumin levels. B. Oxygen saturation levels. C. Blood glucose levels. D. Electrolyte balance. Answer. A. To prevent the spread of infections due to a weakened immune system. Rationale. HIV patients have a compromised immune system, making them more susceptible to infections. Good hand hygiene is essential in preventing infections. 140. A nurse is educating a patient with HIV about the importance of good hand hygiene. What is the most important reason for this recommendation? A. To prevent the spread of infections due to a weakened immune system. B. To reduce the risk of accidental needle stick injuries. C. To prevent allergic reactions from medications. D. To prevent the spread of HIV to others. Answer. A. Nutritional intake and albumin levels. Rationale. Fatigue and weight loss may indicate malnutrition or wasting syndrome. Assessing nutritional intake and albumin levels can help identify causes and guide interventions. 141. A nurse is educating a patient with HIV on the importance of taking ART regularly. Which of the following is the most important point to include in the teaching? A. Taking ART as prescribed will reduce the viral load and improve immune function. B. Skipping doses will help reduce medication costs. C. You can stop taking ART when you feel better. D. ART can be stopped once your CD4 count is normal. Answer. A. Taking ART as prescribed will reduce the viral load and improve immune function. Rationale. Consistent adherence to ART is key to reducing viral load, improving immune function, and preventing drug resistance. 142. A patient with HIV is admitted with a fever and cough. The nurse suspects pneumonia. What diagnostic test would help confirm this diagnosis? A. Chest X-ray. B. Blood culture. C. HIV viral load test. D. Pulmonary function test. Answer. A. Chest X-ray. Rationale. A chest X-ray can identify pneumonia and other respiratory complications commonly seen in HIV patients, such as opportunistic infections. 143. A nurse is caring for a patient with HIV who has a CD4 count of 180 cells/mm superscript 3. The nurse knows that the patient is at high risk for which of the following? A. Opportunistic infections. B. Hypertension. C. Hyperglycemia. D. Kidney disease. Answer. A. Opportunistic infections. Rationale. A low CD4 count indicates immunosuppression, which places the patient at greater risk for opportunistic infections, such as tuberculosis and pneumonia. 144. A nurse is caring for a patient with HIV who is receiving trimethoprim sulfamethoxazole, Bactrim, for the prevention of pneumonia. What is the most common side effect of this medication? A. Rash. B. Weight gain. C. Hyperkalemia. D. Seizures. Answer. A. Rash. Rationale. Rash is a common side effect of trimethoprim sulfamethoxazole, Bactrim, especially in HIV patients who are immunocompromised. 145. A nurse is caring for a patient with HIV who is prescribed tenofovir. The nurse should monitor the patient for which potential adverse effect? A. Renal toxicity. B. Hypertension. C. Hyperglycemia. D. Hair loss. Answer. A. Renal toxicity. Rationale. Tenofovir can cause renal toxicity, so renal function should be regularly monitored during treatment. 146. A nurse is preparing to administer antiretroviral medications to a patient with HIV. What is the nurse's primary responsibility before initiating ART? A. Assess the patient's understanding of ART. B. Check for possible drug interactions. C. Obtain a baseline viral load and CD4 count. D. Review the patient's medical history for chronic conditions. Answer. B. Check for possible drug interactions. Rationale. Checking for drug interactions is crucial before starting ART to ensure that the medications will work effectively and safely together. 147. A nurse is caring for a patient with HIV who is experiencing fatigue and difficulty concentrating. What is the most likely cause of these symptoms? A. Side effects of antiretroviral therapy, ART. B. Hypoglycemia. C. Hyperthyroidism. D. Acute HIV infection. Answer. A. Side effects of antiretroviral therapy, ART. Rationale. Fatigue and difficulty concentrating are common side effects of ART, especially during the early stages of treatment. 148. A nurse is educating a patient with HIV about preventing the transmission of the virus to others. Which of the following should the nurse emphasize? A. Use condoms during sex to prevent transmission. B. HIV is only transmitted through blood transfusions. C. You should avoid all physical contact with others. D. You can transmit HIV only if you have symptoms. Answer. A. Use condoms during sex to prevent transmission. Rationale. Condoms are an effective method to prevent the sexual transmission of HIV. While ART can reduce viral load, the use of condoms is still recommended for protection. 149. A nurse is caring for a patient with HIV who has developed Kaposi sarcoma. What is the nurse's priority intervention? A. Provide pain management and assess the lesions. B. Administer intravenous fluids. C. Educate the patient on the importance of ART. D. Encourage the patient to participate in physical therapy. Answer: A. Provide pain management and assess the lesions. Rationale: Kaposi sarcoma is a cancer that often causes painful lesions. The nurse should prioritize pain management and monitor the lesions for changes. 150. A nurse is caring for a patient with HIV who is about to start ART. What is the primary goal of initiating antiretroviral therapy, ART? A. To decrease the viral load and increase CD4 count. B. To prevent drug resistance. C. To cure the HIV infection. D. To eliminate symptoms of HIV. Answer: A. To decrease the viral load and increase CD4 count. Rationale: The primary goal of ART is to decrease the viral load and increase the CD4 count, improving immune function and preventing disease progression. 151. A nurse is educating a patient with HIV about proper nutrition. Which of the following is the most important dietary recommendation for the patient? A. Increase your intake of protein and calories to prevent weight loss. B. Limit your intake of vegetables to prevent bloating. C. Avoid foods that are rich in carbohydrates. D. Drink only clear liquids to stay hydrated. Answer: A. Increase your intake of protein and calories to prevent weight loss. Rationale: HIV can cause weight loss and wasting syndrome, so it is important to increase protein and calorie intake to prevent malnutrition and maintain strength. 152. A nurse is caring for a patient with HIV who is at risk for pneumocystis jirovecii pneumonia, PCP. What is the best prevention method for this patient? A. Administer prophylactic trimethoprim sulfamethoxazole Bactrim. B. Provide an influenza vaccine. C. Encourage increased fluid intake. D. Educate about smoking cessation. Answer: A. Administer prophylactic trimethoprim sulfamethoxazole Bactrim. Rationale: Prophylactic treatment with trimethoprim sulfamethoxazole Bactrim is recommended for patients with HIV at risk for pneumocystis jirovecii pneumonia, PCP. 153. A nurse is caring for a patient with HIV who is taking raltegravir. The nurse should assess for which potential side effect of this medication: A. Muscle pain or weakness. B. Fever and chills. C. Tachycardia. D. Visual disturbances. Answer: A. Muscle pain or weakness. Rationale: Raltegravir is associated with muscle pain and weakness, which should be assessed regularly. 154. A nurse is caring for a patient with HIV who is about to undergo a liver function test. What should the nurse be aware of regarding the impact of ART on liver function? A. Some ART medications can cause hepatotoxicity. B. ART medications improve liver function in HIV patients. C. Liver function tests are not needed for HIV patients. D. ART does not affect liver function. Answer: A. Some ART medications can cause hepatotoxicity. Rationale: Certain ART medications can be hepatotoxic, so monitoring liver function through tests is important for detecting early signs of liver damage. 155. A nurse is providing education to a patient with HIV about adherence to ART. The nurse should explain that which of the following is a potential consequence of non-adherence to ART? A. Drug resistance and treatment failure. B. Increased energy levels. C. Shortened treatment duration. D. Rapid weight gain. Answer: H. Drug resistance and treatment failure. Rationale: Non-adherence to ART can lead to drug resistance, treatment failure, and increased risk of disease progression. 156. A nurse is caring for a patient with HIV who is experiencing diarrhea. What is the nurse's priority action? A. Assess the patient's hydration status. B. Administer antidiarrheal medications. C. Encourage high-fiber foods. D. Provide a low-sodium diet. Answer: A. Assess the patient's hydration status. Rationale: Diarrhea can lead to dehydration and electrolyte imbalances. Assessing hydration status is crucial for ensuring adequate fluid balance. 157. A nurse is preparing a patient with HIV for discharge. Which of the following is the most important point for the nurse to include in the discharge teaching? A. Continue taking your ART as prescribed and attend follow-up appointments. B. You can stop ART if you feel better. C. Avoid all social interactions to prevent infections. D. You will no longer need to monitor your viral load after discharge. Answer. A. Continue taking your ART as prescribed and attend follow-up appointments. Rationale. Adherence to ART and regular follow-up appointments are essential for managing HIV and preventing complications. 158. A nurse is educating a patient with HIV about the importance of regular viral load tests. Which of the following is the primary reason for performing viral load tests? A. To monitor the effectiveness of ART. B. To assess the patient's immune function. C. To diagnose opportunistic infections. D. To determine the patient's prognosis. Answer. A. To monitor the effectiveness of ART. Rationale. Viral load tests are used to assess how well ART is controlling the virus, guiding treatment adjustments if needed. 159. A nurse is caring for a patient with HIV who is experiencing night sweats. Which of the following conditions should the nurse consider as a potential cause? A. Tuberculosis or other infections. B. Side effect of ART medications. C. Anxiety or depression. D. Gastroesophageal reflux disease (GERD). Answer. A. Tuberculosis or other infections. Rationale. Night sweats in HIV patients may indicate an underlying infection, such as tuberculosis, which is common in immunocompromised patients. 160. A nurse is caring for a patient with HIV who is taking ritonavir. What is the most important assessment to make while the patient is on this medication? A. Liver function. B. Blood pressure. C. Kidney function. D. Heart rate. Answer. A. Liver function. Rationale. Ritonavir can be hepatotoxic, so monitoring liver function through regular tests is critical to identify any liver-related complications early.